Good evening, everyone. My name is Lee Storo. I'm the Executive Director of the North Carolina AIDS Action Network. I want to thank everybody for coming out to our annual tradition of doing a World AIDS Day event policy conversation in the days following World AIDS Day. Many of you know that World AIDS Day always falls on December 1st and is the globe's longest standing public health advocacy day, in which we remember those we've lost to HIV, but also think and plan toward the future. We've been really honored for the last 3 years to host an event in the days following World AIDS Day, specifically designed to catalyze our movement and help us think about the policy work we have ahead. And it's actually, I've realized, had a nice arc the last 3 years. 2 years ago, we hosted this event at the Duke School of Public Policy in Durham over breakfast. Last year, we hosted it at the LGBT Center of Raleigh over lunch, and this year we found ourselves in Greensboro at North Carolina A&T University for dinner. So I'm not sure what that means about what time we're going to host the event next year, but really value this opportunity for our community, both locally in a specific part of North Carolina, but also with a statewide focus to think about the issues we have in front of us. I want to give a quick shout out to my team members of the North Carolina AIDS Action Network. Matt Martin and Rita McDaniel played a big part in making this event happen tonight. And I also want to acknowledge Alicia Diggs, who's one of our board members with the North Carolina AIDS Action Network. Let's give all of them a round of applause. And finally, I want to take a moment to thank the sponsors who helped pay for both this event and the advocacy work the North Carolina AIDS Action Network does 12 months out of the year. The Human Rights Campaign is our presenting sponsor of this event, and we specifically wanted to take a moment to highlight 2 guides that the Human Rights Campaign has released. This year, the Human Rights Campaign released HIV 101, a guide to HIV prevention, treatment, and care on college and university campuses, and Making HIV History, a programmatic guide to confronting HIV at HBCUs. We've got, for those of you who are here in person, copies of these resources at the back of the room, and we'll also be posting them electronically when we get the video up on our YouTube channel from this event. Also want to give a shout out to the Cone Health Foundation, Avita Pharmacy, Gilead Sciences, Janssen Infectious Disease, Merck, and ViiV Healthcare, whose contributions make both this event happen and the general work of the North Carolina AIDS Action Network. With that, I'm really pleased to pass things off to Dr. Sharon Parker, who we're really honored is helping host this event at NC A&T tonight. Dr. Parker.
Good evening.
Good evening.
I'd like to take this time and welcome you to North Carolina A&T State University. I just want to give you a little bit of information about A&T that you may not be familiar with. A&T was established in 1891 and it is the largest HBCU in the country. We have students at the undergraduate level, the master's level, as well as the PhD level. A&T has over 12,000 students and roughly around 441 faculty members. And we have 17 centers and institutions located at this great university here at North Carolina A&T State University. North Carolina A&T State University is also ranks 3rd in the UNC system in terms of bringing in grant funding. So real kudos to my colleagues here at A&T who are doing work from engineering to public health. I'd like to also take this opportunity to acknowledge our Student Health Center here and our representatives here. Our students are very involved in working with health disparities, specifically around HIV prevention and PrEP. A&T is very fortunate to have a PrEP ambassadors program, where we actually have students who are on the ground, going out, doing the work, and educating other students about PrEP. So I'd like to take this opportunity to give these students and individuals who are representing this part of our campus a round of applause. And I look forward to this wonderful event and enjoy.
Awesome. Okay. Last but not least, I do want to give a shout out to the Triad PrEP Working Group. My colleague Matt Martin has really been involved with the working group here in Greensboro, and we know from a statewide perspective there's some really fantastic regional work happening here in Guilford County. So all of you who are part of the Triad Working Group, PrEP Working Group, thank you for all you do. With that being said, I think we're going to get out of the way and invite our moderator and panelists up to the front of the room.
All right, can y'all hear me okay? So welcome, thank you all so much for joining us for Getting Prepared, accelerating HIV prevention advocacy in North Carolina. We really wanted to have this convening to talk about the state of PrEP in North Carolina. I feel like as folks who are part of the HIV community and work in HIV, we hear a lot about PrEP and we get a lot of PrEP 101. What is it? What does it do? How does it work? But we don't really get down into the meat of it as to what are the barriers that we currently have, who is currently able to use PrEP, who still has little access to PrEP, and what is the advocacy that we need to do in our community to make sure that the folks who are most in need have access to it. So we wanted to make this a little bit of a different conversation, and we're really excited that y'all are joining us tonight. We've also got a great group of panelists that I will let introduce themselves. I'll introduce myself first. I am Matt Martin. I use he, him, and his pronouns, and I work for the North Carolina AIDS Action Network as the Grassroots Advocacy Coordinator. So I work more on the community level, and I will just let us go down the line and say who you are, your pronouns, and where you work or what organization you're affiliated with.
So my name's Evelyn Faust, and I'm currently the Communicable Disease Branch Head, working with the Division of Public Health, specifically out of epidemiology, and I'm absolutely honored to be here. Pronouns are she, her, and hers.
Hello everyone, I am Angel Wiley. I am currently a junior public relations student from here, Greensboro, North Carolina, and I serve as an employee at the Student Health Center here on campus as well as a PrEP ambassador.
Hello, I'm Chris Klisch, and I am hail from Hickory, AIDS Leadership Foothills Area Alliance. We provide services in prevention and care in 9 counties in rural-ish northwestern North Carolina.
Good afternoon. I'm Jeffrey Collis. I am actually a PrEP user. I use he, him, and his, and I'm a data analyst by trade in higher education, studying student behavior and enrollment metrics.
Awesome. Well, let's give a round of applause for our panel for joining us tonight. We're excited to have a lot of different voices from throughout the community join us tonight, so thank you all for joining us. Before we get started into the conversation with the panelists, I'm going to turn it over to Evelyn Faust to give us a brief kind of overview of what HIV currently looks like here in North Carolina.
Thank you, Matt. And also I want to thank Dr. Parker. Just had the privilege of working with her at a meeting on World AIDS Day, and it's such an honor to see you again, and thank you for your great work here. And then also thank Lee Storrow, who has just been a huge champion, if he, could I embarrass him just a little bit, across North Carolina. The North Carolina AIDS Action Network is critical to all of the work that all of us do, because they have really made a point to be inclusive, to continue to have conversations all across North Carolina. And you know, our state's big. You know the expression Murphy to Manteo, and there are many miles to drive. And so, you know, that work is never done. Our communities are very diverse, and there are communities within communities. But I really appreciate, Lee, the work that you've done to be sure that our work around HIV and AIDS, and specifically, you know, the opportunity we have now to end HIV for the next generation. Let's do that in North Carolina. But thank you, and Matt, thank you for letting me be a part of this panel. I appreciate you and all the staff at NCAN. But when you see leaders, you know, they're willing to step forward and pull us together and also continue these important conversations, we have to take a minute and say thank you. And I see some old friends out there. Thomas, you know, I've known you for like my whole career, and we won't say how many years that is. That'll be our secret. And Tara, all of you, you know, you're so many familiar faces. I've had the opportunity to work in public health since 1984. I was in Mecklenburg County, actually, when I first heard of the word HIV. It wasn't, as you guys know, called HIV back then. It was HTLV-3 in terms of the original test, and then it was referred to as GRID, or gay-related immune deficiency syndrome, many other names. People were terrified and very fearful. And at that time, you know, I was working with already with the state. But, you know, I was among, like many of you in this room, some of the first trained to actually start to counsel people who were newly diagnosed with this thing called HTLV-3. That was, again, the lab test. And it was difficult. It was challenging. It really, in public health, you know, we're used to giving news it's not so good, but then we could say what to do to help you. And back then there wasn't a lot other than, we could reach out and to hold somebody's arm or hand, or we could refer them to very few clinical trials that were happening in North Carolina. The real difference came when people such as yourselves decided that this was an our issue, not just somebody's issue over there or the big cities in San Francisco or New York, or that it wasn't just exclusively among white gay men, but that we realized, that this virus could affect anybody who was sexually active, and regardless, it was affecting people that we loved and that we cared about. And so volunteers from all over North Carolina, without a dime in their pocket, Thomas, I'm talking about, came together and started saying we're going to have support groups, and we're going to drive people to clinical trials if we have to, and we're going to be there for them. And that was the early foundation of the North Carolina HIV response. And so many individuals went above and beyond, to just be there for somebody. And then because of the collective voices that were heard, that there needed to be more done, there certainly was eventually money put into developing agencies at prevention or care, and then thankfully, into research so that treatment was actually effective. Early treatment, and I know we have some ID physicians in this room, it saved lives, but it also made people really sick, and it was difficult early to take. That's not true with the effective treatment that we have today. So I look back on all of that. I haven't forgotten those stories, but I was in Greensboro, way back when. I know that this university was out front and a leader. You have to remember that although I hope this panel will talk about stigma, because that is still one of the major barriers that keeps people away from getting tested for the first time or getting people into care for the first time, or people will drop out of care if we're not treated well, if we're not respected and valued for who we are, people won't stay in care and treatment. But I look back to where we were 30 years ago, when oftentimes you were told AIDS, you have AIDS, and it was almost a death sentence at that time. At least that's how it felt to people, compared to where we are today. And I want to thank you humbly and gratefully for all of the work that you have done to make HIV a continued priority response in North Carolina. Now, I'd like to tell you that that's a wrap, right, and we're done, but we know that we have more work to do. We have over 40,000 people that we estimate in North Carolina to be living with HIV, and we suspect that there are 5,000 people who have HIV out of that 40,000 that are not yet diagnosed. So think about that for just a minute. Thomas was sharing with me that this university had a recent testing event and that you reached over 200 students. That's amazing if you did that. That's amazing. Any person who's sexually active or thinking about being sexually active needs to get an HIV tested. And you need to, the HIV test in and of itself is not protective. Now I know I'm preaching to people that know about all this. But the part I want you to hear is that's where our work's not done. That if there are 4,000 people that have not yet been tested or are undiagnosed, we've got to start together thinking about what can we do to get them tested for the first time. And then make sure that that experience is a good one so that they'll get tested again if they remain sexually active. Routinely, you can go into your doctor's office, and I'm very proud, I do all infectious diseases in North Carolina. I was just at my doctor's office recently, and it was advertised, get your flu vaccine. And I want to take a moment, tell all of you, if you've not had your flu vaccine, get your flu vaccine, okay? However, you don't see a sign that says, and if you've not been tested for HIV, get tested for HIV. Why is that important? Because of the people that are newly diagnosed, we still have over 1,300 people each year that are newly diagnosed with HIV. So we have to, and the treatments are so effective that of the people that are in our care programs, thanks to your all's efforts, we have achieved over 86% of those that are virally suppressed. And viral suppression, with the amazing care that we get from physicians and the treatment, is so good that not only can they live long and prosper and get into all of the bumps and lumps of older age that I'm sure none of you know anything about, but they can't transmit their virus to other people. And we've known about this for the last couple of years, that thanks to the 052 study, which was led by Dr. Mike Cohen and many others, that came, and Dr. Cohen is leads the Global Infectious Disease and Health Program here in North Carolina at a UNC. And thanks to the physicians in your communities, people can, within 6 weeks, begin to see that they're virally suppressed if they're infected with HIV. So it's not a cure yet. It's not a vaccine. There are serious clinical trials happening right now in North Carolina and the people involved, both from Duke and UNC and many others here, in Greensboro, they can tell you that they feel they're very close to either a vaccine or to a potential cure. Imagine that for just a minute. And the method of getting your medication is getting easier. In some people, they can take it 1 pill a day, just like we take blood pressure medicine. There's trials underway to see if we can make that treatment even more effective. Like, there are birth control that you can go on where you can have an implant. That's a very big possibility. Why that would be important is that some people don't take pills well. So what if we did it even easier than that? There are so many things that are just right there at our fingertips, and yet I can tell you that there's 8,000 to 9,000 people right now living with HIV that are not virally suppressed and they're out of care. So where we're doing well in North Carolina, and Matt, I will wrap this up for you so you can get into PrEP here, is that of the people that are living with HIV, you look back into the 80s that I was talking about, our death rates are down. Across all of the races and our sexual orientations, we're doing so much better. We are living with HIV. In fact, we changed our HIV control measures this last year, thanks to North Carolina AIDS Action Network and many people in this room, so that the language that said people with AIDS, right, that's gone now. It's people living with HIV. That was significant. And if you're virally suppressed, and if you're in care and treatment, then the issue about the state, I'm just going to be plain talk, being in your business is over. We wish you well. If you need us, we're there. So the work I want us to think about as we think about PrEP, because PrEP, you're going to hear, it's 90% effective if taken well for most people. And you do need to talk with your physician. But PrEP, again, will prevent people who are not yet infected from getting infected. But what can we do? That's the conversation that Matt's about to lead. What can we do to get that word out? The disparities in care is what we also have to continue to grapple with, which is that while we have had great achievements, our African American populations, particularly when you look at young African American men who also have sex with men, we're not doing as well. We're not reaching them. I'm just going to put it plainly. Some have heard about PrEP, and I hope you guys will talk about this. Heard about PrEP, but their providers are not encouraging them to take PrEP. And then some of the people that we care about who happen to be African American and who have also have sex with men, they don't even feel comfortable yet being who they are with their providers or with their families. So that goes back into stigma. Until all of us is in care and treatment, if that's where we need to be, until all of us have heard the message and had an opportunity as we to take PrEP and prevent HIV, if that's the solution, until all of us recognize that this work that we do to end HIV in North Carolina is going to benefit each and every one of us, then our work is not done. So I have been doing this for about, okay, I said I wasn't going to say, it's like getting towards 3 decades. And I don't feel like I can quit yet. I don't feel like I can let go yet. I know that sometimes our young leaders say, I wish you would, it's my time. And it is their time. But I want us in North Carolina to be the first state to be able to claim that we have achieved beyond what the National Health Strategy says, which is that, you know, they want us to get as close to 90% virally suppressed as possible. We can do it. We're at 62%. There's the work that we need to do. So that's my message, and I'm not going to quit till y'all quit. So thank you for being here today, and especially in this very historic university that is clearly choosing to make a difference in HIV. So I thank you for that.
Awesome. So yeah, so we will go ahead and open it up to our panel. So I've got a couple of questions that I've got planned, and then I thought we would take some time with those and then open it up for y'all. And like we said, I'll try and repeat the questions that y'all have with the mics just to make sure everybody hears. So my first question for the panel is, tell me about your PrEP story or your involvement with PrEP and what it looks like specifically in the communities that you're a part of and that you work in. So y'all can popcorn as you wish. Somebody can jump in.
I'll jump in. It's fine. So I was introduced to PrEP initially when I started working for the health center during training, because my beginning responsibility is to teach sexual education, healthy relationships here on campus. But now we have a section included in the curriculum that teaches what PrEP is, what is HIV, what is sexually transmitted diseases and infections, but it also explains PrEP. So that's where I was introduced to PrEP, and I was blown away. Mm-hmm. I'll start there, because you fear what you don't know. Mm-hmm. And I didn't know the power of PrEP until I was introduced to PrEP. So, did I answer the whole question?
Yeah, absolutely. Oh, what does it look like in your community currently? So I know you're working here at NC-A&T as a PrEP ambassador for the campus. What does PrEP look like here at A&T currently?
In my community, I would say that it's still unknown. Of course, we're working hard as students. Me and my colleagues, my bosses, things of that nature, are working to spread more information, educate, advocate, and just make people aware of PrEP. But it's still, people still get uneasy talking about HIV, period. So you have to break that barrier, and then you have to get to, well, there is PrEP. So that's the thing that we're working on. You have to get creative when you're talking to students my age, because you'll lose them if you don't grab them in the beginning. So, yeah.
Awesome. Chris, I'll pass it to you.
All right. I guess my involvement with PrEP goes back to my involvement with HIV. I moved to North Carolina from California, and a very liberal part of California to a very conservative part of North Carolina, and was kind of looking for a way to get involved in my community and make a difference, and realizing that the stigma around LGBT issues was astonishing in the community where I lived in. So I looked in for a way to plug into an organization that I could make a difference with, and there actually was not a Pride organization or a youth organization when I moved to Hickory. There is now. So I started working with Alpha as a volunteer, sitting on the board of directors, and I went for a master's of public health, and doing that I kind of made HIV my thing. And during that I discovered PrEP, and it was just kind of like, why don't I know about this? Why does nobody know about this? Why does the board not know about this? Why doesn't anybody know about this miracle pill? So I kind of made it my mission to get PrEP into Hickory, I guess, and I had the fortune to be able to take the position at Alpha as the executive director in 2016, and that was pretty much from the get-go. It was, we are going to get PrEP. We are going to tell everybody we can about PrEP. We are going to do everything we can to promote PrEP. Finding providers was really difficult. I can get into that later. But I am really happy to say that as of July 1st, Alpha has a PrEP navigation program, and we've enrolled 15 people, which maybe doesn't seem a lot to you, but it's a lot for us. Mm-hmm. We had a phone call at 9 a.m. the day the program launched to get someone enrolled. So I'm just, yes. I'm so excited about that.
PrEP for me was an absolute must. I am an adult male who's sexually active. I prefer the company of other men, so I think it's an obligation upon me to make sure that I don't allow myself to get sicker or sick, and that I don't harm anyone within my community or within anyone with whom I'm intimate. That's kind of a sacred obligation. I will soon be 49. I remember too the days of GRID and the talk of that and the horrible pictures that we saw. I remember getting a call from some faculty members at an institution where I had attended who said, "We know that you were intimate with Charles. He's dead. You need to get tested." That was in 1991, and I remember waiting 14 days to get a test result. And now I am part of a study that's, I want to say, toggling between somewhere. I'm either on Truvada or cabotegravir, but I am protected, and that's a good thing. I'm excited about that. But now we get a test result in 20 minutes. I'm like, that's amazing. Do you know what 14 days was like? But my husband and I the other night, I said, isn't it wonderful now, a year on PrEP, that you can get a sinus infection or a cold and you don't think, well, I must have it now. And so it washed away a little bit of that fear. And like, okay, not so bad. And I have to really give a big shout out to my friend in the back of the room here, Miss Bridget. She is a rock star. I've known Bridget for probably 14, 15 years. She has always been an HIV educator. She has, she's the one who introduced me to the study that I'm on, and I'm thankful to be here.
Can I ask a question?
Absolutely.
Oh, excellent. So the state is, in my view, we've been a little bit behind in getting our statewide PrEP program off the ground. And so we also came here tonight, I came here tonight with great gratitude to hear about the local programs that, you know, were way out ahead of us. We have just gotten in a small grant, and we are trying to seed PrEP programs in Eastern North Carolina. We're hoping, because that's an area that is really out-resourced when you look at some of our urban areas, and miles there, you know, between physicians. And we're working with Wake and Mecklenburg, and hope to be working more with you all. And I will hope that we can like form a statewide group next year. Something I want to talk to NCAN about, because, you know, we're not going to be able, we have to tailor, I think, the messaging depending on whether we're talking to younger people or older people, depending on whether there's any PrEP awareness or no PrEP awareness. And, you know, just like our Alpha director said, in some communities, there's none. There's absolutely no awareness of PrEP. And then, but my question, Matt Scullion, is she going to ask a question in the speech? My question, especially here to you at the university, since you've been working with young people, you said, you know, nobody knows anything, and then there was a lot of fear. Can you talk more about that? I am really interested, you know, in hearing what are people afraid of? What is it that they don't know?
I'm glad you asked. And don't mind me, I'm not attached to my phone. I did a Instagram study because we live in the age of social media, okay? So one of the questions I asked, it was a poll, was if you were dating someone and they said they had HIV but you wouldn't contract it if you got on medication, i.e. PrEP, a month before you began to have sex, would you get on it? And 46% said yes, and 54% said no. So my next question was, if no, is it because of the stigma or the chance that you still may contract it? 25% said the stigma, and 75% said the possibility. So again, I would say that one of the hardest barriers is the stigma. Stigmas are just hard because, you know, you get to, well, I have HIV, but when do I tell them? Or I have HIV and I don't really want to tell them because they're going to feel different about me, but again, they don't know. So they fear the unknown, and the stigmas come from unknown and things of that nature. But I think that's the big barrier, but it's kind of sometimes I get to a point where I think people are scared to even find out. So that's
Scared to find out if they're HIV positive or not.
Scared to find out if they're HIV positive, and scared to hear what HIV is and how it's even contracted. Some people just like to freely engage in sexual intercourse, and they just think that they are invincible. So you have to consider that. And, you know, being in the Black community, some people just don't want to talk about HIV. So that's one thing I notice a good amount of time on campus.
Thank you.
If I can throw into that the stigma that's related about PrEP, I mentioned to a colleague, I'm coming to this panel, and they're like, "You're on PrEP? Why?" I'm like, "Because I have sex with people." "But I thought you were married." Well, you have a construct in your mind about what that means to you, but the world doesn't play that the same for everyone else. But I feel kind of looked at differently. There's not everybody that I disclose what medications I take, simply because there are judgments. And if you spend 10 minutes with me, you probably much figure out I'm an out proud gay man. I'll tell you everything. You know, like trying to be diplomatic while I'm on this panel. But I'm active on Twitter, and I saw this little thing pop up because I was like looking at PrEP hashtags and things, and this guy said, "Tomorrow I'm getting my first test." I immediately looked at the program. "You're 21. How are you just getting your first test? What's wrong with you? How long have you been having sex?" You know, and I looked at his timeline, and he's like going to sex parties and things like, "Honey, I'm so glad you're getting tested. Now can we get you on PrEP?" And I have even had a few students that on campus, you know, going to something. I was the GLBT student group advisor on campus for about 3 years. And I asked some students, who in here has heard about PrEP, whatever, and there were people going, "What's PrEP?" I'm like, "How have you not heard? Have you not read at least one thing that said the word on it anywhere? How are we not getting that word out more? How can we get it out more?" And it's not my field, it's not what I do, but I've kind of feel I have a sense of obligation to say it to everybody. Had an activity with someone recently, and I said, you know, "Here, full disclosure before we act, here are these things about me. I'm negative, I'm on PrEP." And he just kind of looked at me for a minute. He said, "You know, I need to be a more responsible sexually active adult and probably do that." I went, "Yeah, that's nice." So I think just being able to disclose that before you get into something has a lot of power. It's frightening. It's sometimes not something somebody wants to hear or welcoming, but I think we have an obligation. We have to get out of the stigma of talking about sex being bad. We all got here via that route. So,
I think it's.
I'll make a comment.
Yeah.
I just was listening to at what you were saying, Abigail and Jeff, about the whole fear around stigma and HIV testing and PrEP. I would argue that we have an opportunity with PrEP to really empower people in a very positive way, and kind of potentially, I mean, people are still going to be scared of HIV, although frankly, we know we can live long, healthy, productive, normal lives. There'll be stigma, unfortunately, and we'll have to fight that. But we can change it from being such a fearful thing to, I'm like, I want to get my HIV test, and if I'm positive, let's get on treatment, and if I'm negative, let's get on PrEP. And so instead of being something you're afraid of, think about something you're getting excited about, to get on, to find out if you want to be on PrEP, that you don't have HIV, and let's get on PrEP. Or if you do have HIV, let's deal with it, let's move on. You know, I'm a provider, and I don't have HIV myself, so it's easy for me to talk that way, of course. I'm trying to be respectful of people who are living with HIV. But I'm making the suggestion that we have a potential opportunity to empower people and change the messaging, which I think is important, to change it from a negative sexually transmitted infection kind of world to a sexual health world, and a world about being who you are, loving who you love, and being happy.
Agreed. Just for the purpose of the microphone, I'm going to try and paraphrase that. But the main thing that I got out of that is with the tools that we have, especially with PrEP and treatment as prevention and U equals U, undetectable equals untransmittable, we have an opportunity in our society to empower folks about their sexual health and be able to take that into their own hands and make it something to celebrate and not something to fear, and kind of delete that stigma. Is that an okay paraphrase?
Dr. Carter's raising her hand.
Is
for us to have transparent conversations. I am a professor here at North Carolina A&T State University. I do research around HIV and AIDS. I'm chair of the Triad PrEP working group. Oftentimes when I sit down and we're at these meetings and we're talking about getting to zero, we fail to be inclusive of all the individuals that are at risk for HIV. We will not get to zero in the state unless we begin to look at other populations of people that are at risk for HIV or at risk of contracting HIV. I understand where the highest rates of HIV remains and the need to work with that particular population. But it is rare that I'm at the table and someone is talking about someone that looks like me. Mm-hmm. It's rare that I'm at the table and they're talking about HBCU students. Mm-hmm. So I want to use this as an opportunity for us as we come together as a state to think about how do we make this message inclusive. And we can't just follow the dollars. Right. If we're going to get to zero, or the challenge may be that do we need to redefine what zero is in terms of how we're going to get there. And that is where I am in terms of this fight. I truly want the state to be the first to get to zero. But if we're not including other populations, we're actually fooling ourselves. And we're doing a disservice to us.
May I ask a counter question? Whose responsibility do you all think it is to get the word out about PrEP?
All of ours.
Everybody.
So the question was, whose responsibility is it to get the word out about PrEP?
Everybody. And you know, Dr. Parker and I, again, we had a little chance to spend a little time together Saturday. I think her point is very well taken. So, you know, both men and women are at risk of new HIV. Both men and women that are living with HIV can benefit from early treatment and become virally suppressed. But there are very different dynamics when you're trying, it's kind of what you and I were starting to talk about, different dynamics at play when whether you're trying to reach a young person or whether you're and motivate them for either prevention or to get back into care, or when you're working with, we're trying to motivate grown, you know, adults, men and women. For women in North Carolina, they often do feel left out of the conversation. And when you look at our rates in women, they are less likely to get into care early. They often wait until they get a late diagnosis, which is, I want to say, is unacceptable. That's not personal to them, but I think Dr. Parker's point is when we're messaging, what is it that we need to say? And the state does not have that figured out. One reason I wanted to be here tonight, and I'm appreciative of the invitation, is that we intend next year to get out and about. I really want to get out of Raleigh and come back, you know, to listen, because that messaging, you need to tell us. You know, the panel needs to tell us. You got, and again, I think to some extent, Matt, whatever the community is, what is it that young people need to hear to get tested for HIV for the first time, and or to be able to get empowered? Thomas and I were talking, what can we do to empower the 8,000 people that are not in care? I want you to think about the numbers, and I would encourage, I put some, especially for you, Dr. Parker, I brought some information that I put back at the back of the room, and you can pick it up. It's available on our website, and it talks about HIV in North Carolina and some of our health disparities. And there are some suggestions about things we could do, but each community has to take this on. HIV started as a grassroots campaign in North Carolina. I tried to talk about that a few minutes ago, and it still has to be that way. What is the message? What are the words? I would like to tell everybody that Bridget used to work for us, and we miss her terribly. She worked in our HIV medications program, so I'm so glad that she's here. But what is the message, Matt? That's what I kind of want to hear from the panel. What words do we use?
If I can throw out something?
Yeah, go ahead.
You know, I'm looking just at this making HIV history, and I agree completely. And I also agree completely with Dr. Parker. Bridget and I have talked about disparity in access, and I'm a gay white guy. everything speaks to me. But even with state employee health care, I'm afraid in this state. I'm concerned about how will I continue on PrEP when this study is over. Is it going to be denied me on the health care plan? For any of my friends that are GLBT, Black, White, Latino, Asian, how do they feel at this quote-unquote upper echelon of privilege that I get to inhabit? I know some of my black brothers that are sexually active, that I'm good friends with, don't even feel safe to imagine that. How am I going to afford this medication? I don't want to start if I might have to go off of it. And I decided I was going to face the risk and start it anyway, and I'd figure it out once the study's over. But that's privilege. That's opportunity. We have to start making a difference. We have to, what I saw in this was black, gay, and bisexual men. There are some of my black male friends who do not identify as gay or bi. They just like to have sex with men sometimes. And that language of putting people into boxes and pigeonholes of who does what with who primarily or most of the time or 64% of the time, we've got to stop that. If you are sexually active, I don't care where you're putting it or who's putting it in you, get on PrEP.
I feel like there's like a psychic power in the room, because my second question was about stigma, which we talked about, and then this one is we've gone into the topic of barriers, which is my next question. So y'all clearly reading my mind.
I'm sorry. Could I just
yeah,
another population that we really need to be talking about is injection drug users.
Yes, thank you.
We, the counties that we serve, 2 of them have been identified by the CDC as at risk for an HIV outbreak, like the one in Scott County that infected 200 people. We are terrified. We are working double, triple time, getting the prevention message out. We started a syringe exchange, pushing PrEP to these people, but most of these people that we see are not insured. So the funding part of that is hard. It's hard to tell people that there's this magic pill, but we're not really sure how you're going to pay for it. We started a 340B program that hopefully when it grows, we'll be able to help many people, but if we leave the injection drug use population out, we are going to have a big problem.
That's exactly right.
It's not just injection drug users. Stigma starts from the beginning, and if you don't feel comfortable saying I'm an IV drug user, I have multiple sex partners, and you cannot go to your physician and have this conversation without being judged, then we're never going to end stigma. Because you need that conversation like 101 sex. This is how mom, dad, mom, however it is. If I can't come into your doctor's office and I can't have this conversation because I may feel like if I tell you I'm an IV drug user and I have small children at home, I could lose my benefits, I could lose my child, I could lose my housing. But at the same time, you tell me that you want me to have this conversation with you so that I can take A, B, and C. But if I'm going to lose everything over here, then I'm not going to tell you anything.
I totally agree, and I think that is one benefit of having community-based organizations doing testing. That my staff's completely non-judgmental. We've heard it all. We don't care where you put it, what gets put in you. We don't care. We just want you to get tested, to know, to learn how to reduce the risk, and to get treatment if possible.
I was just going to make a suggestion. I think that making the messaging about PrEP as broad, like you were mentioning, Chair, Dr. Parker, as possible, including all these people, it really, people should think about PrEP like condoms, right? I mean, when someone goes and buys condoms, presumably, you know, there's not something about an analysis about how many partners they have or how promiscuous they may or may not be, if you want to use that word, or nobody's it's just going to get condoms. So like, if someone's going to go ask for PrEP, and I always tell providers, like, if someone comes to you and says, I want to be on PrEP, That's it. Then they put them on PrEP.
Right.
Do not try to argue
Right.
them or yourself out of it.
Don't ask me, why are you wanting to do that? Which I have had asked when I
It's
asked.
fine to explore risks and things, and but just if they want to be on PrEP, put them on PrEP. And consumers consumers of healthcare should feel that they have the right to go and ask to be on PrEP and be put on PrEP with no questions asked.
Yeah, we've actually had such little luck reaching out to providers that we kind of pulled back on that kind of campaign and put it on consumers. So more of a push campaign, telling every single person that we test, which is about 1,500 people a year, every educational program, just to make sure at least the consumers know that it exists.
Right.
Right.
And then hopefully it's happened a few times. Someone's asked their doctor and their doctor's researched it and put them on PrEP. But
you can push it though in the provider field. We've pushed it here
well,
locally in Greensboro.
with resources from that new PrEP coordinator position
Yeah.
that's opening up, we'd really love to
Well, I
do
mean,
that.
Providers don't know
I heard
about it,
that.
too. About, the percentage of providers who don't know about it is very, very high.
Well, yeah, we sent 300 postcards out to providers in our 9-county area, inviting them to ask us more information about PrEP. There was a educational thing for one of the hospital systems, and no response. No response.
We've had some success, but we've also been operating in an arena, like Dr. Snyder and I have been doing promotion of PrEP here regionally in Greensboro. But of course, we have relationships with folks. So if we call up the head of our primary care and say, hey, can we come talk to you about PrEP? Or someone asks them a question about PrEP, and say, can we come talk to you about this? They'll have us at their meeting, we'll come and talk, and they'll let us, you know, because we already have a relationship. So I think when you have those relationships to leverage, you have the opportunity. And I think there are a lot of providers who actually have gotten quite excited about prescribing PrEP, and I think there are a lot more. There's been growing the number who have, but and I would argue actually, I just was thinking about women's health while Dr. Parker mentioned things, and I've talked to obstetricians. I'm thinking of Tanya Pratt in particular about HIV, and obstetricians are fairly comfortable talking about sex actually, and certainly pregnant women always get tested for HIV. They're supposed to get tested at least twice during pregnancy. I would say that that's an opportunity with OB. That they test for STIs and more likely to test for HIV, but then they'll also throw into the conversation PrEP. So I think there are a lot of different types of, I would do it from both angles. I mean, I think the consumer, you got to do it too, but I think if you can provide it too.
Absolutely.
I think that's ideal.
Then it's going to, the messaging will get out.
But when it comes down to funding and you have to make a choice.
Oh, yeah. We did it for free, Dr. Snyder did it for free.
But how do you reach the community that's outside of your network? See, you all have built relationships.
Yes.
But this past year, I worked with Lee and Matt at Triad, and every woman I asked, had they heard of PrEP?
Yeah.
And 97% said no.
Yeah.
So my suggestion to them was the next time that you go to your primary physician, bring the subject up. But if our circle, you might as well say that our circle is small, because we're only using who we know.
Right.
But there are a lot more physicians on the outside that we're not reaching out to.
Right.
They have no idea.
Right.
I mean, I remember years ago, I was having a PIC line put in, and I don't even know how me and the nurse got to talking about it, but I was talking about female condoms. And she's in the nursing field. She had never seen a female condom, didn't know what it was. So weeks later, I came back to her and I brought her one. And she's in the medical field. So how do we get to other departments in other areas? Because these people have people in their circle or who they provide medical care with that have lifestyles that are not talked about because they're only focused on their main health issue. And that plays a big part, because even though there is A, B, and C going on, they're still maybe sexually active, and that medication may have some complications, or it may not, but that's something that you would want your physician to know, or that provider to know, in case something happens. They can say, okay, well, I'm taking PrEP. You know, can you give me some information? Or do you need to know this? Because PrEP is not a conversation that we have over coffee. You know, it's not something we're just getting the commercials on late at night and it's on to certain programs.
Right.
It's not a conversation that We can, even with HIV, that, you know, it's really, really strange this flu season, and I thank you for bringing it up. You find people putting on masks and gloves, but nobody cares about who they sleep with, and whether they use a condom, or whether they're on PrEP. So we have to really open up this conversation further than just what we see locally.
Well, you know, I think your points are welcome. What she was saying is, you know, the more and more people, more and more providers. We got to get more providers on board. Got to get the community more on board, and it's going to take a lot of work, which is why this conversation is so important. And you have to know your community. You have to know, you know, it's already started here in Greensboro, but your point's well taken. Greensboro takes a while to get from one end to the other. I've been lost here many times, and I can testify to that. But, you know, you think about the HIV test. HIV was licensed back in the 80s. You know, we started testing for HTLV3. The primary reason that it moved into public health clinics was to keep people from going to the blood bank to learn their status, because when we first got the test license in this country, there were very few places that were doing it. Blood bank was one. So then that fear, you know, caused public health and other providers to do it. But 6 is when CDC rolled that. Took from that 1984 to 2006 for CDC to come out and say HIV testing should be routinized into everybody's primary care. That's pretty amazing it took that long. You're talking about having it in your drawer. I want to tell you this quick story because I think your point's so important. It's got to be in everybody's drawer. Federally qualified health centers, community health centers, gynecologists, OBGYNs, absolutely. Can't just be another infectious disease issue, and we don't have 20 years to wait. You know, if we want to end the epidemic in HIV, we can't take 20 years this time. We've got to get it out there quick. But I was in my kitchen this weekend. I pulled out the drawer that has everything in it. I know all of you have one, right? I was looking for a short spoon that I have to stir, and I'm rooting around in this drawer, and suddenly I found a condom. And it blew my mind. And I'm thinking, why is there a condom in my drawer? And then I went, and I have 3 kids, that's all I'm going to say. Why is there a condom? Oh, it's mine. And what happened is that I was cleaning my counters and from a trip, right, and pushed it in the drawer. But the point is that I think the picture I'm trying to create is that when the physician pulls their drawer of things out to do for their patient, they need to know about PrEP, right? And when our community pulls their drawer out about things I need to do, you know, as I'm beginning to be sexually active, or if I'm going out tonight, they need to know about PrEP. It's got to be that, your point, you know, well taken. It's got to be that common, and we have a lot of work to do there to get there. Too much not known. The other thing is the barriers about who's going to pay for my lab tests. This young man down here brought that up. And that's keeping some agencies, they're afraid of that. They're like, well, I don't know if I can take on the costs for PrEP. And we've got to change that to say, well, you can't afford not to, right?
Matt, I have something to say.
Yes, please.
So one thing.
I will say, I have like one more question after this, and then I will open it up for questions. So if y'all will like hold on to it for just a second, just so we can kind of pass it through the mic just to make sure everybody's heard. But give us just a second and we'll open it up.
One thing I want to say, as we all are talking, that I realized, the thing about PrEP and HIV is we also have to study the demographic and also study how they respond, but more specifically, how you are delivering the message. A lot of times people are so quick, well, this is PrEP and everybody needs to get on it, and there it is. Like, it's not a come in sensitive.
Right.
And I think that's one key thing, because one of my success stories is, as I was teaching a class, of course I met them, I loved them, and my colleagues, we have this thing, you know, what happens in this room stays in this room. If you want to talk about your sexual lifestyle, you want to talk about anything, whatever you say in this room stays in this room. You don't know the person to the left of you, you don't know the person to the right of you, but it stays in here. And I also pretty much tell them, you know, I'm like your sexual fairy godmother. So, you know, just if there's something you want to ask me at the end of class, you can, like, I'll give them my cell phone number, I give them my social media. And one guy messaged me in the middle of the night on Snapchat and was like, I want to get on PrEP. And I want to believe that it's because of the way me and my peers delivered the message.
Absolutely.
It wasn't the information, it wasn't what we said, it was how we said it.
Absolutely.
So I think it's important when you're trying to figure out how to get the education out about PrEP and HIV and sexually transmitted disease and sexually transmitted infections, that it's important to focus on how you're going to deliver the message and just not solely focus on the message.
Absolutely.
So.
For sure. Awesome. Okay, so we've talked about kind of what it looks like currently for y'all. We've been talking about barriers, which was my next question, so y'all did great with that. So because we are kind of taking an advocacy focus on this and like the steps moving forward as to what we need to do as a community, let's say we did a lot of advocacy, and in a perfect world, the North Carolina General Assembly decided to allocate some funds specifically for PrEP throughout North Carolina. In your community, paint your perfect picture as to what that would look like for your community. As far as you've got this money, we've talked about how funds are a huge barrier for a lot of folks and a lot of different communities. You've got the funds, so what do we need to do with it?
Pay for labs. Pay for labs. That's a huge barrier for us.
Can you describe the labs? What labs do you need?
Well, there's like a full panel of all the STIs. There's a liver and a kidney. I don't really know. I'm not the clinical person, but I have it broken down. And labs and office visits for a year are about $1,200, which isn't insurmountable. But if you start talking volume and giving something to one person and then not being able to give it to the next person, it's like if we threw open our doors and said, we can get you on PrEP, and it's going to not cost you anything, or it's going to cost you $50 at each doctor's visit or whatever, we could get a lot more people. And that's what we're working towards with the 340B funding, or savings, sorry, that we can do that eventually. But right now we have to pay for our program and pay for the coordinator to get the money rolling in. But if we had the opportunity to just tell people, come on in, we'll get you hooked up, and it's going to cost you barely anything, we would get a lot more response.
So just comment, I think she's exactly right. We are working toward, in fact, I have to thank again North Carolina AIDS Action Network and all of your work. Last year we were able to be recipients of funding to expand our viral hepatitis testing so that now any local health department can offer free testing for viral hepatitis, which now includes hepatitis B and hepatitis C, because we've been able to leverage thanks to those funds that came in. So we're working toward being able to, at least the lab work for HIV tests, because you need to be, if you're going to go on PrEP, you need to be HIV negative. You're tested for STDs. As well as your testing for viral hepatitis, it's important to know that, should be free. Where we're going to struggle together is the lab test around liver enzymes. And within HIV and STD clinics, those are not routine tests. So
I think you just need a creatinine, frankly. I don't think you need the liver function test.
I think that's important to repeat, so make sure people.
So the comment was just need creatinine, not the liver functioning test.
Yeah. We're getting
that
enough.
is from the mouth of a doctor.
So. From a physician, right. I want to be sure I didn't say that, but I've heard that from several other practicing physicians, and that's the importance of what's coming out of the clinics that have been very assertively prescribing PrEP.
But we need to find those providers that aren't going to require that, because what we know, even like with the hepatitis C treatment, the FibroScan, you don't have to do that for every case, but we don't have a provider who will skip the FibroScan. So that bumps the cost up $2,000, which puts it out of range for many people.
I'm a type 1 diabetic. I inject insulin to stay alive. My total cost per month to stay alive is $407 in copays. I have health insurance.
Wow.
I don't own a home because I've been spending hundreds and thousands of dollars every year to stay alive. I'd like to take that $400 and go on a vacation. I do that once in a while, but not taking care of myself with my diabetes. I know that there are people who can't afford that $400 a month. How are we going to expect people, and folks go, oh, what about copay cards? Are you doing these discounts? Yes. I spend an inordinate amount of time renewing those damned things every year and having to get, pre-authorization and overrides and paperwork. I'm a college-educated white guy. I have that as a little bit of opportunity and time. There are a lot of people who don't have all that. And, I need you to fill out all this paperwork, and then we're going to wait and call you back and tell you if we can fund you test strips so that you can know whether you need to go to the hospital or not. Jesus, Mary.
It shouldn't be that hard.
So it shouldn't be that hard. What we need really is so much bigger, revolutionize healthcare in this country, burn down all the insurance companies. But we have to start valuing human lives more than we do our pockets. And everybody needs access. And I'm sorry I got on my little preacher kick there. But there are a lot of folks who don't have this as an opportunity. We have to make it available without so many road bumps, without so many hurdles.
Yeah, for sure. And I would say, especially in North Carolina, one of the things that we're focused on, and both for folks who are living with HIV and for folks who are not living with HIV who could gain access to PrEP, is our first step needs to be to expand Medicaid in 2019. Just my little. And yeah, I know you were about to say something, so I'll pass it to you.
Oh, I was just going to piggyback off of my fellow colleagues, panelists. I would say labs in a perfect world. I would also say advertisement, because who said it? They play it in the middle of the night.
Yeah.
And then it's called. I've seen it a couple times.
WRAL?
Yeah.
WRAL. I saw it after Empire the other night.
Yeah. It's not every network.
It's like after 9.
Like 10.
Yeah.
I've seen it with sports shows, sports games.
Really?
I've seen it on Nick at Night.
They've expanded it.
Hulu.
Yeah.
But your point's well taken. It's not, we don't have a statewide campaign about PrEP. And so that's, again, I think something that we can work on next year with some of you. But please don't wait on the state. I mean, community by community. You need to be thinking about what would your campaign look like. Whose face is going to be on it? I think whose face is on it is really, really important, and then the specific message.
I'm not looking for a clothing allowance, but I have Googled many a time. I'd love to find some really cool t-shirts about getting prepared, about making HIV history. I would proudly wear those and not worry about things. And be kind of an advocate for PrEP as somebody who is taking it, to say, hey, I'm willing to talk. I'm willing to be a face. Just let's talk and be. I can't believe there are people who don't know what it is. People that I'm beating over the head. Are you on PrEP yet? Are you on PrEP yet? Why aren't you on PrEP yet? Come on. I can help get you on PrEP. I know who to hook you up with. So.
I think finances play a big part in it.
Yeah.
Well,
I'm right along with you.
That's why
I want right along with you.
New PrEP clinic was.
Here, in Greensboro, there's a new PrEP clinic here.
Yeah.
And they're working to get those issues. Actually, they have it in place where you can get, if you're underinsured, uninsured, they can get you on PrEP.
But just to point out that it is so complicated. Like you were saying, college-educated white guy has a hard time working it out. The person that we have doing patient navigation, every single case is different with the insurance, and it is absolutely ridiculous how much time she has to spend on the phone. Now, the people that are working full-time jobs and can't do that, why does it have to be so hard? Your doctor prescribes you medication and you get it filled. You shouldn't have to jump through so many hoops.
So I think this line of discussion is important for just a second. Are you guys talking about the compassionate care programs?
No, this Cone Health Foundation, it's our Regional Center for Infectious Disease. We have funding from Cone Health Foundation to provide PrEP for 40 individuals.
I see.
40 individuals in terms of labs and visits. It's a pharmacy-driven PrEP program, so our clinical pharmacists, Min Pham and Cassie Koblaiser, prescribe it, but it pays for visits with them, it pays for the labs, and then we use Gilead's Advancing Access to pay for 100% of the meds. And actually, Gilead's program does pay sticker price at whatever pharmacy you fill it at, so you can, that's another thing, a conversation. But I was going to say that, that one of the big things we're trying to do right now is push out the message and advertise the fact that we do have this PrEP clinic It's for, well, it's for insured and uninsured, but we have funding for 40 uninsured folks.
Who provides that funding? Because I
County Health Foundation.
have funding for 4
Yeah, this is
uninsured
County
people
Health.
through the hospital.
It's, County Health Foundation. I mean, they provide funding for our clinic. They provide funding
that
for
like
a
a-
lot of things.
Is that the regional?
How long for the program?
Well, we applied for this. I think we have the next. I don't want to speak out turn without Sandra Boren here or someone from County Health Foundation, but I believe we're going to have secured 2 years. We're in the first year, and we're going to apply for the next year. We're very confident we will get it, but we also want to put 40 people on it.
So is that a local foundation?
It is a local
That's what I'm
foundation.
asking. Okay.
So
It's good, but my question is kind of like Jeffrey was saying, because I argued about this a few years ago when it was introduced to Triangle Empowerment Center, when they were adding middle color MSMs.
yeah.
The problem that I see, first of all, women weren't included, and I have a problem with that. But you pay for it for a couple years. You get people to change their lifestyles to have protection. But then when the funding is run out, those people have nowhere to go after that. And I know you can pray and apply, but if you don't get funding, what happened to those people who have been on this program for several years and have gotten accustomed to being on PrEP and have changed their lifestyle, maybe not totally, but to have the security of knowing that I get this prescription once a month and it keeps me from catching HIV. But if the funding is gone, I'm off the program, is no more, I can't get it, that's not going to change my lifestyle.
Right, but I don't know that changing lifestyle is always easy to do in the first place. And there's been arguments about whether PrEP really changes lifestyles anyway. That's
No,
a
I'm not
separate
saying to
argument.
change lifestyles. I'm saying their lifestyles that they live while they're on PrEP.
Oh, okay.
So, you know, you're bringing up a really good barrier, which is that people have been on programs and then let down. Sometimes communities feel like that, you know, we research them, we study with them, we start things, and then we lose funding and they get dropped. That is a specific culture experience in the South, you know, that we've seen over and over again. However, you know, we do need to push together. And back to what Matt said, you know, the bigger solution is that we need a Medicaid expansion, and we need a Medicaid transformation, which our department, you know, is working on, which is to look at a whole person, not just parts of people, but a whole person, you know, which includes the behavioral and mental health pieces in that, and invite people to be a part of care, not wait till they come, or tell them you need to do this. People don't like that. What I think we're going to have to do if we want more people on PrEP, which we do, is to start building some trust. And we also shouldn't promise something we can't deliver. I think that's one thing I hear you saying. So we have to say we're going to get you started. Can't promise forever. You have to be upfront. But if you're only on PrEP for a year or 2 years during the time period when you're very sexually active and you don't get HIV, that's a good thing. That's important. And the more people that get on PrEP, then you create need, and then you can never forget the advocacy, which is where you have to move to say, now, you know, we just like when we came 30 years ago and talked about we need free HIV testing in every clinic in North Carolina, we'll have to do the same with PrEP. You know, that's why I said in my opening remarks, the work is never done. But let's help people get over those fears. Just be honest about it. You know, honest that what you're signing up for may not be forever, but this year is important, so let's take it.
And Gail, you was talking about communication and as far as, you know, PrEP, and then you talk about PrEP. I'm gonna come from the community because I'm a community activist as well as a national speaker and living with HIV myself. And I have access to the community. I got up and got in the community. We do have people on PrEP. And you made a statement about your approach. My approach and why I've been so successful It's because I have social media on lock as a man living with HIV, and I have the young folks following me. And the topic of discussion is PrEP, U equals U, the new North Carolina control measures. Those are my top 3 topics. I've been given permission to be at the depot whenever I want to, anytime I want to. There's not an issue for the conversation. The issue is funding, how much it's gonna cost. That's what I hear coming from my people in the street, young, old, the LGBTQ, whatever. I address and meet everybody. Their main concern is price. They don't have a problem taking it. How they gonna pay for it?
That's what we need to spread words about, because there are providers. I'm being pretty loud about our thing, but there are other people who are providing PrEP also, and there's finite resources for
But
everybody.
the thing I think, the community, y'all, providers, you service your people who come to you.
Right.
You understand what I'm saying? I'm in the street and I take it to the people.
Well, we need to work together.
We can do that. All you gotta do is let me know, and I can make it happen. We can all set up at the depot. We can have a health fair, and it can get done. Because I've been given permission by the administrative staff from the GTA.
So I saw a couple hands. So we'll start with some questions from the audience. So Terrell, I saw your hand.
Yeah, it's really not a question, it's just a comment. And some of you heard before, you're not gonna like to hear it again. An angle is kind of what you said about the advertising, and it's kind of what you're saying about advertising, using advertising. I've been, does anybody know the numbers nationally on PrEP? I think we have 150,000 people on PrEP.
Yeah, maybe that.
Yeah.
National.
National, around 150,000. It's been out since 2012.
Right.
No pun to the maker, I'm very glad it's here, but it's been a horrible rollout. It's been an absolute horrible rollout. And I'm not talking bad about Gilead, I love Gilead, they saved my life. At every United States conference on AIDS I'm at, I tracked down Douglas Brooks, who used to be the AIDS czar, who is now with Gilead, and I brought it up in sessions that Gilead needs to do some national advertising. We cannot, and they started. They started.
Right. 6 years in. Right.
I got a teammate already. So really, politely, in a thankful way, every time I'm around them, I hit them for that. Because as someone that lived and was cured of hepatitis C, I immediately noticed when the hepatitis C medicines came on national advertising that the stigma for hepatitis C went way down. So if we could really get some kind of real national advertising about PrEP, what it does, I think it would do 2 things. One, it would educate everybody about PrEP, and not to knock anybody's credibility here, but when they see it come from a drug maker, it adds credibility instantly. But if we can get them to do that, and it's not all on them, but I just feel like that is something that is really needed. And every time I'm around somebody with Gilead, I bring it up every single time. And they're very receptive to it. They know. They know that, but just think of those numbers. Next year we'll have been out 7 years, and there's 150,000 people, and I think like 75% of them are the gay, white, LGBT community. And they're not the ones that you're talking about that we need to be hitting. So I just wanted to make that comment that if, as individual advocates, we're able to communicate that to Gilead in a kind of gentle way, that it might help the whole PrEP situation.
Sharon, I have a question for you.
This ties in. North Carolina A&T Student Health Center, under the direction of Stefan, did a wonderful video for HIV prevention on HIV Women's Testing Day.
National Women and Girls HIV Awareness Day.
Can you talk a little bit about that? Because that video spoke to HIV prevention without bringing in all the stigma that's associated with it?
Sure. So we over in Student Health Center, we typically celebrate every month. We have additional initiatives and what have you. National Women and Girls HIV Awareness Day came around, and we decided to shoot an in-house video, something 60 seconds that could be posted on social media, retweeted, what have you. Because as we know, it is the day of social media. Everything travels faster once it hits the internet. So we actually had young African American women that were on campus, right? That said, they were HIV negative, but I'm going to stay negative, and here's why. And I'm not at risk just because I live a risky lifestyle, but it's because of a lot of factors that I can't control, because I'm college age, because I live in the South. Different things that put me in a category, if you ask a physician, that classify me as high risk. And that message really did a lot for the particular population that we were talking about, the African American, young African American woman that oftentimes in this message is not adhered to. So that's just kind of how we tap it in on our particular, our forefront. So just more like I said, not to echo more of the message that's already been said, but definitely when you know the population, and we know essentially PrEP is something that anybody and everybody should be aware of, and that they should at least consider if you're sexually active human being, right?
Yes.
Right. So there's not going to be just one message or just one campaign that's going to hit everybody. It's got to come from a whole lot of different angles, and there's going to be a different form. Just every different trends and things that's got to catch people different people's attention. And I think we have to be okay with that and know that what might have worked last year might not work this year. That doesn't mean that we failed and we did something wrong. It's just we have to change. And I think that's just how we will be successful as a group.
Yeah, really good point. So just to echo, there's a video that the Health Center created around HIV Awareness Day for girls and women. I think if we can get that information, that'd be great, and I can spread the word about taking some stigma out of HIV testing and whatnot. And also just that the importance of not having one message, but rather several different messages to reach every community, because like you said, PrEP is for everyone. If you were sexually active, PrEP is for you. And kind of breaking that down. I know I saw Bridget's hand, so I'm sorry, I'm trying my best to re-echo everything into the microphone just so we catch it on video. I'm not doing the best, but Bridget, I know that you had a question.
Yeah, I had a question for Ms. Wiley. So what are some of the ways that you get creative with the students as far as getting a message out about PrEP, being a PrEP ambassador, and how do you address their concerns with insurance, especially if they're covered by someone else's plan?
Great question.
So the question was, what are some of the creative ways that Angel and the folks at NCAT have gotten the message out, and then how do they talk about the barriers, especially around payment and whatnot?
So the first thing, as far as PrEP ambassadors go, we are dedicated and always working on different programs. We, the Health Center is known to be a programming body, so it's you can reach more when you make it a program versus a one-on-one thing, and intrigue them with food and a free T-shirt. But so one program we are working on is fear factor. So essentially saying there's no fear factor in PrEP, but they go into a room and they are blindfolded, or at least their eyes are closed, and they have to stick their hand in a box. They don't know what's in the box, and they touch it and they may get scared, but when they open their eyes, they realize it's a furry bear, and they thought it was something else. So they put their hands in a pile of gummy worms, and they're like, oh my God, what is that? What is that? But once you open your eyes, it's just gummy worms. So that's how PrEP is. When I said in the beginning, you fear the unknown. So if you just open your eyes and listen and be open to being educated, that's how we can get the word out about PrEP. As far as insurance goes, again, a different success story. I had a student come to me and express to me that he was HIV positive, hadn't told anybody, and he was already stressed because he found out, his mom doesn't know, and he's already in debt just from getting tested, getting he wasn't even on the medication yet. So of course I offered to take him to the health center on campus because I feel like that's my duty as a peer facilitator, as a student advocate, as someone who is promoting the proper sexual health and sexual precautions. That's something I should just do. But he's stressed because he's like, I'm HIV positive, I'm already in debt, and I'm in debt from before I even came to school. And he didn't even know that he could go to the health center and get better insurance or get on medication, because he found out in July and he didn't start going to see an HIV professional until around October. So imagine somebody living with HIV in debt and no medication.
Yeah.
So, but we also, as a student health center employee, we also stress the fact that we are not professionals. We can lead you to the water, but there's a professional that knows what the water has in it. So that's one thing we are big on, but we always want to take you to a professional. So that's the big thing about insurance. But it's hard when you don't have any money, especially if you're in college and you're newly infected, and it's just hard.
And it sounds to me that maybe part of that story too was that they had he talked to his parents yet?
No.
Yeah.
No.
So, you know, that's the other, of course not, right? And we hear those types of stories all the time from, you know, 20-year-olds, 21-year-olds. And if you look at the data, and I'm a big believer in understanding our data statewide and your data community, we have way too many. It's unacceptable for 13 and 14-year-olds, 15 and 16-year-olds sexually active young people, young people, to be getting infected with HIV. But they don't want to tell mom and dad yet. That issue, Bridget, about insurance is critical, because if they were to seek care, then their mom or dad is usually who's paying insurance, would know then that they're either seeking PrEP services and or that they're living with HIV. So those are barriers. But there's, you know, Matt, you asked, so I want to tell you what is needed for funding. And we do need funding, so that's number one. I can say that right now. And we used to fund in this state, I'm sitting here having a memory, HBCUs across North Carolina to do the very work that these people are already doing. And that funding was cut about 6 or 7 years ago. And so let's rethink about some of that, because you can hear the power in the university in reaching out to young people and the power of them being part of, you know, a community. It's incredible, not just for PrEP, but for HIV care. We need to rethink about that. And then overall HIV prevention, because I'm not going to forget about Alpha sitting down here. We have not had an increase in HIV prevention funding for community-based organizations in almost a decade. Other than, and we're grateful for that specific shore up funding that we got for viral hepatitis, because there was zero money, and we have around 115,000 people living with Hep C in North Carolina. We have increasing hepatitis B, and we currently are in the middle of a Hep A outbreak. So all the folks that we've been talking about tonight, they've not been vaccinated for Hep A, and we do have a population of young adults that are not vaccinated, because it was 2006 before the vaccine was recommended for school age for Hep A. And so we now have a Hep A outbreak. We're going on 45 cases plus, and that doesn't sound like a lot compared to 115,000 people living with Hep C, but it doesn't take much. Our states, southern states around us, have thousands of have at least, like Tennessee and Virginia have experienced 1,000 cases. So, and all of these issues, you know, HIV, STD, viral hepatitis, they can be addressed, you know, by comprehensive one-time opportunities like what's going on here at the university and what you're obviously supporting at the clinic, et cetera. It's just about getting empowered and getting out there and asking for what you want.
I just wanted to mention to Bridget that our patient navigator has in the past had success separating the billing for patients under 26 so that the billing goes to them at school instead of to their parents' house. I don't know how she does it, but she has had success in that for that very reason of people who are on their parents' insurance and don't want them knowing that they're on PrEP.
Yeah, luckily North Carolina's minor consent law is pretty good, so there are definite ways
like
to get around that.
STD clinics.
Yeah, so I could give you her information if you wanted to pick her brain.
I'll go here and then I'll go here.
Okay, I'm Denise Eskridge. I'm going to be from THP tonight. I can be from several other places, but I know everybody in this room is kind of beating themselves up because we're not at the beginning, but sort of at the beginning of what we're trying to do here. And I, hearing that, reflected back on, and not diminishing anything else that's happening in this room, because I am a board member at THB, and I'm wholeheartedly involved in this movement. But what came to me was, when birth control became available in this state, how long it took for birth control to get out there. And you can't beat yourself up because we're not making massive movements in the state with this, which has, at the time, birth control had a lot of stigma, but North Carolina had one of the highest rates of teenage pregnancy and infant mortality at the time. I'm really getting excited about this. Sorry. So you can't beat yourself up. But we're here, we're talking about it, and you have to start someplace.
Exactly.
Yeah. So the comment was, it can be hard because it feels like we've been fighting this fight for a very long time. But the comment was that the birth control was a similar fight and took a very, very long time. And I think, like you said, the importance of advocacy is so huge in North Carolina and across the country when it comes to any fight, and especially with our fight to get to zero, to get folks on PrEP, to get folks in care and undetectable. I mean, advocacy is the backbone of everything that we do.
And infant mortality in this state is still not where it needs to be. So we're still working on all of those issues. And we have to give ourselves a pat on the back.
And you had a question right here?
Did Lynn have a song about birth control? Yes, she did.
So, touch on what Angel said about students and their parent being on their parents' insurance. I had recently, like literally last week, a student that used to attend this university. He's now moved to Florida, but his mom, he tested positive here in the Greensboro area, and they moved to Florida, and his mom, he's on his mom's insurance, and she found out from the building that he was taking HIV medications. And he was really scared about it, but they did have a conversation. I haven't talked with him since then. But here's the thing. The information, like you were saying, I've been to a couple of meetings around the state, around the county. The information starts here at the top of the state, gets funneled down to the CDOs in the community. There's a disconnect there, and you need what it's going to take is going to be boots on the ground. Boots on the ground, period. You got to get out into those communities, the sex workers, the IV drug users, all of that. They have to be, you have to meet them where they are.
Yes.
I have taken on the task of doing that through street outreach with condom distribution. I didn't even know about the PrEP clinic here that it opened in August. Recently, I did get introduced to that, so now I have that literature. That's in my toolbox to go out when I go out in the streets. I can speak on that. Over G-Ho here, right now, y'all familiar with the Exxon right here in the middle of East Market? Well, I was there that Saturday and Friday night. I passed out about 500 condoms sitting in that parking lot. And I got to discuss with people about PrEP, prevention, care, treatment, all of those testing, everything right there. And I didn't leave there. I was there for about 2 or 3 hours each night. So it's going to take people getting out, getting from behind the desk and pushing people that are in your organizations to get out in the streets and meet these people where they are. Because otherwise, it's not going to reach them.
Absolutely.
It's going to sit in those offices, and that's the problem.
Well, and that, I think so why don't you rephrase what he said, because I think that really
Oh gosh, that was very eloquent. I don't know if I can do it.
You can't say it as well as you can,
but just the general paraphrase I'll try is that we have to start getting onto the streets and meeting people where they are and disseminating the information ourselves and not letting it come from the higher ups and go down and down and down and down and get lost along the way, but boots on the ground, start in the communities and hit the ground running.
And that's why I said that, you know, as you all work together and do the work, you know, and you're obvious, you know, you're doing that work just like, you know, volunteers did back in the day when there was no funding. There's still work that can be done and be very effective whether you're being funded or not. Just talking to your own family, talking to the young people that are around you, you know. But community-based organizations have been the backbone of North Carolina response. And so that's why I would encourage you all to continue to work with NCAN, the universities, and especially our historical black colleges and universities. They have to be front and center and recognized again and supported for the work that they do to improve the health of young people, you know, while they're being educated to go out and lead the world. You obviously are saving lives. Mm-hmm. If you had one event on this university and 200 kids, and that I say that respectfully, that's from my perspective, showed up and got tested for HIV, that's phenomenal. That's phenomenal work. Yes. And so it's going to continue to take that. I would encourage us, Matt, to work together and show best practices. You know, right when people feel they're weary and they can't, then somebody comes along and says, well, I did it this way. There'll be a best practice for an infectious disease clinic. There'll be a best practice for a community-based organization working with an infectious disease clinic, you know. There'll be a best practice for a local health department. There's already a best practice within a college and university setting right here that you just talked about. And if we can get it up somewhere where people see it, then when they hear the message for the first time as a provider, what do I do? They'll be able to be directed to say, it's not that hard. And your message, our doctor here, that said, you know, you don't have to do all these lab tests, just do that one. Mm-hmm. Providers need to hear that, and they need to see a face if they want to follow up with you. Yeah. That would be a best practice, and it does make a difference. You know, it's always been in North Carolina who you know, mm-hmm. right? Yes. So, and we can't quit. And your point about the community-based organizations, we should all be partnering together. I mean, to me, if I were going to sum up what we need, we have to partner with each other. This issue's too big. There's too many of us out there who need to be on PrEP. And that's a good thing. I mean, we have a solution to prevent HIV. We still should be talking about condom use. We still should be talking about know your status and know your partner status. You know, those are still important messages, but you can take some immediate anxiety off if people are able to get on PrEP and can get access to PrEP. And I think the second thing we need to do is look at who's out of care. I can give you a number. I used to not be able to give you a number. I could tell you in North Carolina, it's between 8,000 and 9,000 people. Mm-hmm. Now, there's 10 million people that live in North Carolina. So what if just the folks in this room divided up? I mean, you know, within, 6 months, we could reach all 8,000 people. Now, I say that tongue-in-cheek, and there's a lot of work that needs to be done, you know, and we need to do that respectfully. But when you think about it, and I want to get to your point about how much we've accomplished together, you know, this is still a fatal disease. Nothing changed. The doctor can correct me about the virus. If you're not treated, if you're not healthy and you get infected, you could still die of AIDS. That virus hasn't changed. What's changed is that we have provided places for people to go to get care and treatment. If there's no resources, those things can be taken care of, but we have to invite them either back to care or invite them to care for the first time.
A lot of these conversations are around providers, social workers, clinical people, but no one brings the person with HIV, their sexual partner, their family members to the table. And until we can include those persons, we're still going to go through this, because most providers work a 9-to-5 job. Community-based organizations, people who do the groundwork, they're getting tired. They love the work that they do, but you just stated that there were so many people out there, and we can't cover it all.
No, you can't.
So you have to bring those people to the round table.
Absolutely.
And have the conversation, because that's going to be the best advertisement that you have, is if you have a couple and one is positive, the other one is on PrEP, and they can have that conversation with their friends. and around the dinner table for those that have disclosed, to spread it and to say how easy or how hard it was. Because see, that's the conversations that we need to have. We need to know how hard it is, because you stated, Mr. Jeffrey, how hard it is for you as a white male, educated, with a job, trying to get PrEP. So how much harder it is with someone that does not have the qualities that you have.
Yep.
But you're not bringing them to the table to find out what their barriers are. So we can't help them if we don't know what the barriers are, because a whole, excuse my French, the shit looks good on paper. But in reality, it's not that way, especially when you're out there doing the footwork.
Yeah, no, I think you're, I'm sorry, Mr. Evans, you go.
I just wanted to say, I'm a data analyst. I can watch your eyes all glaze over the moment I start talking about multicollinearity and statistical significance, and you're like, what the hell? I appreciate all of the science. I appreciate you doctors, care providers, but the language we use, you've got to not just meet people where they are, but you've got to talk to them in a way they can hear it too. Okay? You have to talk to me and be able to talk about all of these anal sex and oral sex, but call it butt fucking, call it cock sucking, whatever you need to do, say it so that it is heard. There are a lot of people who don't know what the word analingus means. Okay, let me go back to Latin here. Okay, I know what that is. Let's get real about human behavior, talk about it, and speak to people in that moment. Let's get out of our science modes and our perfect little politically correct comfort zone words that make us find ways to say those things that don't feel so scary. We're all fucking, okay? Let's protect ourselves.
When you talk, Rita, when you was mentioning bringing the people to the table, you also got to understand, most of them are worried about confidentiality. So it's got to be a safe environment, a safe space. I mean,
some people just want knowledge.
I know, but I think when you talking about bringing men and women in, people in, talking about PrEP or so on and so on, you still got to respect their privacy. And most people are not comfortable being in a big group. So I'm just saying, safe spaces, and you got to understand and respect that as well. And Terrell, my brother here, and all of us who do this work, we've been in them situations, and we know how uncomfortable people feel. So I just look at that, you know, coming from the street. And as far as you talking about the street language, I think I've been effective because of the street. I come from the street. I've been there, done that, you know, so it's effective. But we can do it. We got a great system here, and I agree with Evelyn and everybody else that coming together as a unit, we're on the same page, we got the same vision, it can happen.
Yeah, I mean, I just wanted, the fact that you guys are here and it's 10 minutes after 8 at night, you know, we're all here, sitting here together. We got long drives home, and so I mean, this is why, you know, I know it's not time to quit yet. You know, for me, you are the people I want to hang out with, and bringing people to the table who are living with HIV from the very beginning. Going back to the beginning, there have been people who living with HIV been willing to put their faces out there, been willing to talk about their status when, you know, they knew that there was an audience sitting out there and they were being judged. I mean, I've never ceased to be grateful for the opportunity to know and love and care about people living with HIV. So I'm so glad that you brought that point up. And I don't want anybody to leave this room and not know how grateful North Carolina is to the work that you've done over the years. Like I said, this is still, the disease itself hasn't changed. What's changed is what we've built together in terms of access to care and treatment. We have certainly, you know, been able to get testing out there. This is just one more tool now, the best tool that we've had to prevent HIV. And if any group can do it, you guys can do it. The fact that I'm sitting by this beautiful young person, you know, and there's a little bit of age difference, okay? Just a little bit. But the fact there's just a little bit of age difference, and she is picking up that mission to talk to people in her community about HIV, and that she's willing to drive people to the doctor. You can't tell me you can walk out of this room and not feel hope.
Right.
You guys are amazing.
Yeah, so, yes. So with that, we are a little past time, but as I think there's a really great buzz going around the room, and conversation is just starting, so these will continue. But for the sake of time, let's give it up for our panelists. Thank you all so much. And thank you all. Have a great rest of the night. Grab some food on your way out.